everybody, Nurse Revay here today with one of my favorite patients. He's been on quite a few of my lives before. He's always such a trooper. Today we're going to do a combination treatment. We're starting with TCA. We've already kind of marked out the areas that we're going to do CO2 on. He's had quite the kind of experience with his scarring. We have done a series of microneedling.
Everything.
We've done everything. CO2. His skin looks so much better than when we first started. But with acne scarring, it just takes time. I know it's kind of cliche, but we have to trust the process. It does take time for that collagen to remodel. So right now we are treating his ice pick scars with TCA. TCA is a chemical. It helps kind of build the scar from the inside. It creates a nice little white kind of film, and then it scabs over, and those scabs peel off, and then it moves the scarring inward, so it fills in that space from the inside. Then we're going to do a CO2. The CO2 is more for the rolling scars, so there's never the same depth when it comes to an acne scar. Some are deeper than others, so we're going to concentrate the CO2 with that area. For a comfort measure, we do blocks, so you can see he's a little bit swollen in this area, but he will have no discomfort with the CO2. And it's not an easy treatment, so you've done it before though.
Yeah. Last time I did it, I didn't feel a thing at all. Even like during and after, I didn't feel anything.
Yeah, it really does help with the
super
comfort level.
Yeah. A lot of doctors don't do it though, like Dr. Emer.
Yeah, he even messaged me and was like, "You guys are doing my blocks, right?"
Yeah.
I love that. You know what you're talking about. Go ahead and shine from up light. So we use a light similar to Selfina. We're using a light to kind of see the ice pick scars in the skin. It gives us a better visual when we shine the light up top. We can kind of move it around and see where those are at. You can kind of see that we have the ice pick or the nice white film. That's going to be our clinical endpoint for this. And he doesn't really have as much as he did before, which is great.
So, we have the person asking, how long does it take until his skin improves with this procedure, if you just did it alone?
Yeah, so TCA, you're always going to need a few treatments. Sometimes it can make the scar look a little bit worse before it looks better. So we always, depending on how deep that ice pick is, I would definitely say, 3 to 5 treatments. But it's hard to say without seeing the depth of the ice pick. How many have you had, Michael?
I think we've done a series of 3 TCAs.
Awesome. And he had a combination treatment, like with lasers and such, correct?
Yeah, so he's done, with me, we did a whole series of microneedling, and it was pretty extensive microneedling. We did multi-depth, really trying to turn that skin over and try to improve the appearance of the scar. So blurring that line, that demarcation that you get around the acne scar. We've done TCA, like he said, 3 times. You've had 1 CO2, right?
Mm-hmm, just 1 CO2.
1 CO2.
Anybody
Have you done intensive?
Not yet.
Okay, so intensive is another one of my favorite acne treatments for scarring. We did a live on it last week, but it's a radiofrequency microneedle, and so we're able to control the depth of the microneedle. It also has energy the whole way down of the needle, so it really does help with remodeling at different depths, which is great for acne scarring.
So is that some of the frosting right there?
This is the frosting that we get. This is our clinical endpoint. Like I said, he doesn't really have as many, which is improvement. He doesn't have as many as when we started. So now we're just kind of picking those few ice picks. Most of these are rolling, which means that it's not a clear definition. It's not like some of these kind of look like an enlarged pore, usually caused by acne scars, but these are just rolling. So we're going to focus the CO2 on this area. So we'll be back shortly live with the CO2. Stay tuned.
Thanks, you guys.